and the trend as well. There was a time when it was leveling out, but we do see a slight uptick with our Holbrook and Winslow communities. And that's up to November 29th. Just a trend in new cases. This is when we're talking about the school population specifically, we like to look at what is the trend as far as the age groups of people who are positive with COVID. And we do see the lowest number is the 75-year-olds and older. And the highest are the 25 to 34-year-olds, and close to that is 35 to 44-year-olds. And then we have our teenage population that are not too far from those numbers. And when we break down the pediatric population by age, we do see some positive cases in children. And there's total by November 29th, there's been 248 positive pediatric cases from as young as 0 to 2 years old, all the way to 15 to 17 years old. And the highest rate would be the 15 to 17-year-old age group. And this one just shows an increase from November 22nd to November 29th. You'll see that there was a drastic increase in the 12 to 14-year-old age group. I don't know if that was a cluster from schools. I'm not sure about that, but just kind of seeing the large increase in that number. So that is our data for Winslow Indian Healthcare Center. And so just wanted to provide that to you so that you see what the situation looks like now as far as increase in cases within our communities here locally. Thank you.
Thank you, Sasha. That was very important information. And we're going to turn the time over to the Navajo County. Oh, hold on. The Navajo Nation data, which is going to be given by Dr. Del Yazzie, who is the epidemiologist from Navajo Nation Department of Health. Go ahead, doctor. Doctor, you probably have to unmute yourself.
There we go. Sorry. Thank you, Mr. Harvey. First of all, I'm not a doctor. That's a misprint on the agenda. So, but I am an epidemiologist, though, for the work that we do for Navajo Nation and Navajo Department of Health. Today, my name is Del. I work for the Navajo Epidemiology Center and the Navajo Department of Health in Window Rock. And my plans are and I'm from Cove, Arizona. That's where I'm originally from. Thank you for inviting me to do a little presentation. I'm gonna try and do this as quickly as I can. I know I only have 5 minutes or something. So just a brief introduction with the work we do. The work we're doing with regards to COVID on Navajo. We have a Health Command Operations Center located in Window Rock within our Department of Health. And we are, as an epidemiology team, we have a big team, about 20 to 30 people, part of our epidemiology team, focusing on COVID on Navajo Nation. So I'm going to go over some information that we do have, and it's updated every week. This is the latest information we have for Navajo Nation, and this is what we call the gating criteria. This is our gating measurements the things that we look at for Navajo to determine the status that we should be on, and also how severe COVID is on Navajo, and testing, and so on. So this little box here, I'll start with this. So this report gets generated every week, and we follow it and we share it with our leaders, President Nez and his team, our Health Command Operations Center team, and others. So this box we look at as part of our Navajo Nation on no. So we look at cases, and then we also look at testing. We look at hospital capacity. We look at public health capacity to do contact tracing. We look at COVID disease spread across Navajo. The recommendation for as part of our gating criteria. So these are the 4 indicator or 6 indicators that we look at every week, and we do look at data. We analyze data to tell us where we are. So for this latest report, we are at phase 0. There are 4 phases. The first one is phase 0. So we're still in that very first phase. And you see these X's. They're X's because we didn't meet any of these gating criteria. And then I'll go on. So this is the first chart. This is with cases, COVID cases across Navajo Nation. I hope you can see that. I'm going to try and zoom in. So the first question that we ask is, are cases going down over the last 14 days? So the last 2 weeks. Cases, are we seeing more cases? Are we seeing less cases? Or are we staying about the same? So this graph shows at the bottom is the timeline, all the way going back to March of 2020, all the way to now we're into December. And so this is we call the x-axis. So this is the timeline. But you gave the y-axis, you gave the number of cases. So this is, we started off back in March, started seeing COVID cases on Navajo. Then we saw an increase, and we went through our first wave of COVID cases. And we peaked, like the first wave, we peaked in the middle of May. Although it started to go down, yeah, we were seeing less and less cases. And we were all very happy about that. All the way to like early September, we were seeing small number of cases every day. Although after Labor Day, somewhere around there, we started going up again. And we started going up and up and up. So even now, the second wave, we call it the second wave, is even higher than the first wave. So we are seeing a lot of cases throughout October, November, they were in December. Of course, this shelter-in-place order that President Nez and our leaders put in place to stay home. And then you start seeing this decrease in the cases. So that's where we're at. We're starting to see less and less cases than the number of cases we were seeing like back in November. So, which is a good sign. And hopefully will continue to go down. And that's kind of a picture of what we've seen all the way from March to now. So, and hopefully we'll continue to go down, but we'll just have to wait and see as we collect more data as we move on. DD we generate this map it covers November 27th through December 3rd. It's a 7-day time period. So we look at, you know, the surrounding states, Utah, Colorado, New Mexico, and Arizona, and their 7-day numbers are here. And then our own Navajo Nation, so you know, within that same 7-day time period, we saw 1,421 cases in 7 days, from November 27th through December 3rd. Out of the colors, it is the legend that looks at the risk and the average daily cases per 100,000 people. So purple, there's purple with, you know, 100 to 199 daily cases per 100,000 is all this purple with the service areas. The only two that are, you know, less than that are red. So that's Fort Defiance into the city service areas. But all the other IHS service areas are seeing more cases than Fort Defiance into the city. So we generate this map to show that. How do we look at testing?
You have
Is
about
what
one
we have.
minute. Okay, 1 minute. Thank you.
Okay, the past 14 days testing gating criteria. So this again, the test positivity is currently at 21.8% COVID positive. When we get tested, we're testing people every day, and the test positivity for COVID is currently at 21.8. Again, there's this curve over time from April through now. We're going up again, so this chart shows that. How do we look at hospital capacity? Hospital inpatient beds and ICU beds. This red dotted line is the 80% threshold. So the regular hospital beds is below that. So that's good, but it's kind of going up. But with ICU beds, we're up by that 80% threshold. So a lot of the hospitals on Navajo are reaching their capacity for ICU beds, and that's a big concern. This is the chart that we do too, comparing ourselves, Navajo Nation, to the 50 states, and we are currently at number 1, Navajo Nation. We're seeing a lot of cases, and then these red ones are our neighboring states, New Mexico, Utah, Colorado, and Arizona. How do we compare ourselves to the trend with comparing ourselves to the U.S.? The blue line you get is the U.S., orange you get Navajo Nation. The U.S. going through their 3rd wave. Navajo, we're going through our 2nd wave. So that shows that. And then just very quickly, our neighboring states, we're all in the red, where there's uncontrolled spread of COVID, even on Navajo Nation and our surrounding states. So that's a big concern. That COVID is all on Navajo and around us. So that's this is the gating criteria that we look at, and I'm gonna stop here. I don't know if I can stay on for questions. So thank you.
Thank you very much, Del. You have a new title now. You're a doctor. Thank you very much for that. Great information. I know there's a lot to share, but we have a short amount of time here. But thank you for all of that. We'll definitely share this later with the public. So thank you for all the hard work that you're doing. And I continue to be safe as well. So we're going to turn the time over now to Navajo County. And this person is the public health director there. This is Jeffrey Lee. So, sir, it's all yours.
Well, thank you for having me. I have a few slides to go through to kind of show the current situation that we're monitoring off of the reservation. Much like the rest of the country in the Navajo Nation and Arizona, you can see the confirmed cases by day, and we are all increasing. We are seeing a significant surge this time around. We're seeing a larger surge than previous, and we are anticipating that this surge will last longer than the previous waves, mainly due to the holidays and the traveling and the different things that happen this time of year. It's just going to sustain this surge for much longer. So this is just a snapshot of what our daily case counts have looked like since the beginning of March. All of us are looking at ICU and inpatient bed capacity. As you can see here, both are the availability is shrinking. The red indicates the number of COVID patients in ICU or inpatient, and the dark gray is non-COVID patients. And then the light gray shows the availability. So as you can see across the board, every day there's less and less capacity within our hospital systems. Every Thursday, ADHS updates the benchmarks for schools and businesses. As of today, this is we have moved into the substantial transmission category. This means we've been in the red for 2 consecutive weeks for all 3 benchmarks. And as you can see, we're well above the thresholds to move back into moderate. We have some work to do, and it's going to be some time before the benchmarks and recommendations are for in-person delivery of education. We work with the superintendents of Winslow Unified, Joseph City, and Holbrook. We provide them the data, we'll meet with their school boards, and we'll help them make the best decision that they can for the kiddos in those schools. As of today, I believe all 3 will continue with in-person instruction through the end of the semester. And then over the holiday break, we'll reevaluate and see what the beginning of the next semester might look like. Each one of the school districts, we calculate a rate per 100,000 for the population within the zip codes of the school districts. And the threshold to transition into in-person instruction is a rate of 100 per 100,000. And as you can see here, none of our school districts are even close to meeting that threshold. We have 2 that are 9 times higher than the recommended threshold. So again, it's uncontrolled spread throughout Navajo County. We, like all, are really encouraging getting back to the basics, following the mitigation measures, wearing your mask when you're in public, physically distancing, and most importantly, I think staying home or keeping your kids home if they don't feel well. We tie so many cases back to a scenario where somebody felt like it was just a head cold, or maybe it was allergies, or they just didn't get enough sleep the night before. And unfortunately, it ended up being COVID, and they were exposing everybody they were around for that day, whether it was the other kids on the school bus, the teachers, the support staff, if they went to a restaurant. We just have to really be careful right now and err on the side of caution. And really, if you don't feel 100%, now's not time to push through it. You know, let's be cautious. Let's stay home, and let's really do everything that we can to slow the spread, because right now it really is in an uncontrolled state. And with that, I'd be happy to answer any questions.
Thank you, Jeff, for that awesome information. Very important information. Thank you for all that you're doing as well. Continue to be safe out there. And thank you for joining us. And we're going to go ahead and keep on moving here. So we're going to go over to Matt Morrow. Are you there? He's the epidemiologist with Coconino County Health Department. Matt?
Yeah, I'm here. Hi,
All right.
everybody. Yeah, thanks for having me, and share my screen right here to discuss much of the same thing that was discussed by my colleagues and counterparts around Navajo Nation and Navajo County and around the state. As you can see right here, Coconino County is in a very similar situation. We had the most cases by far that we've seen yet for this entire outbreak reported last week. That week was ending December 5th, 904 total cases. It's a very, very high number. When you look at respiratory illness in general, a number of people with Coconino County being reported to have COVID-19 illness at over 900 cases is very, very high. And so echoing the sentiments that have been expressed and were just expressed by Jeff as far as really following those prevention guidance and really working to stay home and not interact in public spaces. Be very, very careful interacting with family members. We've been interviewing a lot of people that did hang out over Thanksgiving and the holidays, and many of them are now sick and some are hospitalized. And it's very, very sad to see what is happening and hear what is happening within our communities. Looking at one other thing I want to share, or a couple other things I want to share, is a breakdown of those cases, looking at jurisdiction. So sorry about that. This brown line here, tribal communities, many of which are Navajo Nation within Coconino County, have seen quite an increase in cases over the last 5 weeks. After this slight decrease, which was very hopeful, we did see once again another major spike in the number of cases. Same thing happening in Page, another large spike happening in Page. So just to be aware that cases are on the rise and very high, and as was expressed, this one may potentially last a lot longer. So we all have a responsibility and a role to play to work on keeping these cases somewhat contained as we move forward. To show our schools, here's what's happening with our schools. You see a lot of red. A lot of red is the substantial area, meaning all three of these benchmarks fit a substantial category, meaning high levels of transmission. No green, no yellow here. For ADHS, the recommended model for all of our school districts right now is virtual. Down here at the bottom is Coconino County as a whole. Our infection rate, our positivity percent, as well as our COVID-like illness of people visiting the hospital are all above the thresholds to put us in that substantial category within Coconino County. So some very unfortunate situations that are taking place. And same thing, hospitals, not at capacity, but we're discussing with everybody on a daily basis to make sure that there is room and availability, and discussing with hospitals on what might need to happen if they do continue to see increased cases. But that's what I wanted to present for you today.
All right, Matt, thank you very much. And as you all can see, everyone out there watching, those of you who are on Facebook Live with us this evening, this is not a joke, man. It's out there. It's scary. So we really got to pay attention to these and really look out for one another and be safe. So I'm going to turn the time over to, there's a lot of parents out there, people, public, asking about sports. So we have Dr. Wilson with us, the Arizona Interscholastic Association Sports Medicine Advisory Committee Chairperson. So Dr. Wilson, this time is yours.
Thank you. I just had a couple of slides that I wanted to share with all of you this evening. I think a lot of our questions come about sort of, what we're using to make these recommendations and what are we doing to kind of protect our athletes and things like that. And so I think it really helps in many of these town hall meetings, which we've done several of, to really just share with you exactly like kind of what the thought behind many of these is and where those decisions and recommendations come from. And it echoes a lot of the sentiment that's already been discussed this evening, which I think is a great message. And so I'm just going to kind of continue on that. So when we look at sort of return to sport, obviously when we're in the middle of a pandemic, it's never a safe thing to return to sport, but how can we do this safer? Obviously, we know that there are definitely huge advantages to our kids being in sport, the socialization, the mental health aspects of things, physical activity. I am a sports medicine physician, and in the last 9 months, I have never seen such severe bone, lack of bone density and just osteopenia, where the kids' bones are just getting weaker because they're not as active, with being at school and in virtual learning, and then not participating in sports. And so really we have to kind of look at those factors to consider when assessing, a risk for spread in sports, obviously the risk of COVID-19 spread in athletic sports settings, and then those mitigation strategies that many people have talked about this evening to reduce the spread of COVID-19, And then also what we've focused a lot on and looking across the state and then in the individual counties and in Navajo Nation itself, of the level of spread within the community as well, and then kind of looking at a phased return, much like we've done with school. And so we kind of have implored all of those and are continuing to do that. So when we look at factors to consider when assessing the risk of spread in sports activities, different sports have different concerning factors. So in the fall, our easiest sport was cross country. It's an individual sport. They don't have to participate as a team. We can separate the kids. They can all stay 6 feet apart from each other. They run and it was easy to do even competitions with them in meets. And so the physical closeness absolutely plays into factors. And then also the length of time that players are with each other or other staff. And so football was obviously the hardest sport in the fall because there is a lot of close contact. You look at linemen, right on the line. And so as we look into the winter sports, we think about indoor sports as well. And so basketball and wrestling and things like that. And so we'll talk about those a little bit. The amount of necessary touching of shared equipment and gear. So we've really encouraged schools to be able to provide equipment for individual athletes or athletes to provide their own equipment and minimize how much they're sharing. If they do have to share things, that they use hand sanitizer afterwards and between those rotations of athletes. The ability to engage in social distancing while not actively engaged in play. And then also if there are players or staff that are at higher risk of developing serious disease. So if they fall into those high risk categories, keeping them away from other players and having them in a more virtual environment is obviously safer. The size of the team, fortunately in the winter sports, the size of the team actually reduces across the board, which is nice. And then really eliminating non-essential visitors, spectators, and volunteers, and then looking at travel outside of the local community. And so trying to keep communities with similar levels of disease and spread, competing against each other rather than, a high level area traveling to a very low community spread area or vice versa. And then the risk of spread of COVID-19 in athletic settings. So obviously the lowest risk is when you're just doing performance, individual skill building drills or conditioning at home or even with family members. And then obviously to the highest risk, which is full competition between teams from different geographic areas, as I just mentioned. And so obviously there are different levels within that, and we look at those things as well. As far as strategies to reduce the spread of COVID-19, I put this on here and I will share this with you guys so that you can share it with the community as well. This is the link to the AIA online website where our modifications for winter sports are found. And so this is what we've asked coaches and athletic directors to do with their athletes to ensure that basically we're doing all the mitigation strategies we can if we move forward with winter sports. And then when we look at sort of a safer return to sport, so many of those mitigation strategies and, not to harp on the same thing that everyone said, but really promoting those behaviors that reduce the spread of illness. So making sure that coaches are masked all the time, that they're not bringing their masks down to talk to athletes, they keep them up the whole time. And that, even when athletes are not actively participating in sport, that they keep their masks on. Trying to keep them 6 feet apart from each other, maintaining healthy environments, maintaining healthy operations, and then following protocols for sick members of the athletic community. And so some of those healthy behaviors, I think the most important one, which has been recommended by both the epidemiologists that spoke, is really staying at home when you're sick. And so this, athletes are sort of conditioned to be like, tough it out, you're not that sick or you're not that hurt. And we've really tried to give the message to athletes and coaches that it doesn't matter, if you can tough it out through this. If you're sick or you don't feel well, it is always better to err on the side of caution and, prevent the risk of your entire team being out. Really minimizing physical contact. And we're back in that area where we're basically trying to recommend that people don't have physical contact with each other, making sure that they wear their mask correctly, covering the mouth and nose. And then washing hands at regular intervals, anytime that there's, shared equipment or any change of venue. And then also ensuring that vaccinations are up to date. So we've put strong recommendations for everyone to get vaccinated for influenza as well this year as another safety precaution. When you look at healthy environments, we try to minimize shared equipment and also making sure that there are no open water fountains, that they have individual water bottles, that there's not shared water bottles or towels. Really trying to avoid communal spaces. So even in the fall, locker rooms were closed. We've encouraged them to still remain closed. If obviously they're smaller teams, and so if you can socially distance and space your athletes and have individual lockers in the locker room for basketball or wrestling or things like that, that's probably okay. And then practicing outdoors when possible. Obviously, it's cold now in the winter, and you guys are up north, and so it's probably not logistically possible. And then practicing social distancing. So using physical barriers or guides, like marking things off, is really helpful to help people understand how far apart they really need to be when they're participating. Healthy operations, asking the athletes on a daily basis and having them report their symptoms, making sure that you have a COVID-19 point of contact for athletics and sports, which in many schools, if there is an athletic trainer, has been the athletic trainer. We know that many of our schools do not have an athletic trainer. And so oftentimes that role has been turned over to the athletic director or the assistant principal or whoever kind of oversees athletics at the school. And then also we've encouraged, mental health has been one of our big focus areas for the SMAC since I took it over in July. And so also just making sure that, sometimes the athletes' contact is with the coach. So even when they're doing at-home training, also just asking them how they're doing from a mental perspective is very important. And identifying small groups, this is easier now that we have smaller team sizes, but keep those groups together and cohorted. So that if there is somebody who gets sick, it doesn't take out the whole team. It might just take out a section of the team. Staggered arrivals, especially with different teams and different cohorts, and then minimizing the number of people present. And so we have actually made the recommendation for winter sports that there will be no spectators. And that is really to minimize the number of people that are there, and for also to do the due diligence of, if we let our kids go back and play, that we're not contributing to increased community spread of COVID-19. Then limiting your sideline to just really who needs to be there. As far as protocols for the sick athlete, I think this is important as well. I think the most important thing to stress is that if they are sick, don't come to practice. Like, just stay home and let your coach know, not being repercussions for that. And then if someone does become ill while they're at an event, obviously to place a mask on that athlete when possible, make sure that athlete is removed or the individual, because it could be a coach as well, and then notify COVID-19 point of contact, and then make sure that that person is transported where they need to be, whether it's a medical facility or home. And then obviously kind of follow the CDC guidelines, which are actually written in our return to sport recommendations, to make sure the areas are properly cleaned. So our basically benchmarks kind of follow the same thing that the schools had followed initially and that were recommended. And we did that to maintain consistency in the state. And so when we look at number of cases, obviously, as you just saw with all the data that was presented for your specific counties and the Navajo Nation, everyone is above this 100 per 100,000. Pretty much most of everyone across the state is at this point as well. And then as of today, just as you heard earlier, the state overall has moved into being in that significant spread and being in the red in all of those areas. Our benchmark was also 2 weeks of percent positivity below 7%, and then 2 weeks of hospital visits due to COVID-like illness below 10%. We actually just met this morning, so this is kind of hot off the press. And the other thing, which has been echoed in this talk, which has been great, is that also looking at hospital capacity. So we don't want to be part of the problem, we want to be part of the solution. And so the current statewide hospital capacity is at 80% of non-ICU beds and 92% of ICU beds, which is very concerning because we're still not seeing the sickest who will come back from Thanksgiving, just with the time course of COVID. And so everyone is very worried about this. So we did not make an official decision on whether or not we are going to recommend moving forward with that January 5th start date for winter sports at our to endorse what the board of directors had from the AIA had kind of identified as a start date for winter sports. We are going to meet with an emergency meeting on December 31st and revisit that date and see if that actually is something that we think we should move forward. I can tell you that our Sports Medicine Advisory Committee is made up of 25 actually, medical professionals in various aspects of sport. So we have athletic trainers, we have physical therapists, we have chiropractors, we have naturopaths, physicians, and that's orthopedic surgeons as well as non-operative sports medicine physicians. And all of us this morning echoed the sentiment that if our hospital capacity is 90% or above on either of those, that even though we know that kids don't make up a large percentage of that hospitalization, that we're sending the wrong message by not encouraging people to be at home and staying with their family groups and practicing mitigation strategies and wearing a mask, and contributing to people being out to get their kids to and from practice and other things. And so I think most likely we would actually recommend to delay the season. And so that's where things sort of stand with us right now. We're really encouraging everybody to kind of do their due diligence of practicing those mitigation strategies of minimizing, large group gatherings, and even just with group gatherings outside of your family cohort, and really just staying around your own family members, wearing a mask anytime that you're out in public, to really give our athletes the best opportunity to be able to have a winter season. We also discussed the possibility of recommending that winter we, kind of do dual seasons, which I know is harder for some of the smaller schools, and you guys have a lot of smaller schools in your communities. And so because a lot of your athletes play multiple sports, we really also want to give the spring season the best benefit of the doubt of actually being able to play, since they had their season ended last year and they would miss 2 seasons if they weren't able to play because our numbers were still in that severe range. And so that's basically what I had this evening. So hopefully that answers some of why our recommendations look the way that they do. The last thing that I would just say is that some of the other places we get a lot of questions for are after an athlete has had COVID-19, there is a form that is mandatory to be filled out and turned back into the school before they can come back to practice. And that is really because there are some heart problems that can happen with athletes. And we want to make sure that we're protecting those athletes and catching those athletes and making sure that they don't have some severe outcome or that could happen to them when they return back to sport if they're still having some of those heart complications. And so that's the impetus behind that form as well. So thank you for inviting me this evening. I'm really happy to be here and encouraged that you asked us to be part of this.
Thank you, Dr. Wilson, for some very valuable information and also all the work that you guys are doing as well. Thank you for sharing the link. We'll share it with the public. And I know there's a lot of questions a lot of parents have and people. So thank you very much. And I know your job is pretty tedious as well. So thank you so much. And be safe and be careful out there as well. So we're going to keep moving on. I'm going to turn the time over to Alicia Gishi. She will be talking a little bit about mental health awareness. She's the MSPI coordinator with the Winslow Indian Healthcare Center. So Alicia, it's all yours.
Hi, good evening, everyone. Thank you for joining us. And just a quick introduction, like Pac said, my name is Leisha Gishi, and my clans are Kia'ani, Torajitni, my Chase are Ushahi, my Nulis are Ma'idesh Gishi, and originally from Tisto. And I'll go ahead and share my screen here. Okay, am I doing good? You guys see that? Yeah?
Yes, we can.
Okay. All right, so a quick overview of mental health awareness during the pandemic. And there's myself. I have a project assistant by the name of Luana. She's also part of our program that helps me along daily here with our program. So with the pandemic and all, when we think about holiday season, many of us connect to traditions which ground us in our histories, our feelings towards one another, and our hope for a new year. So this year, due to the pandemic, the holiday season will be different for many of us. And for many of us, there will be loved ones missing, along with added sadness. Many are experiencing financial stressors or other hardships. Some are feeling sheer exhaustion from many changes we have had to navigate to get through that moment or time in despair. We may even wish to ignore that there's a holiday season this year. So whatever your holiday season brings, I hope that these tips will help you get through or navigate in whatever way you need to stay healthy and well. And I was glad to hear that Dr. Wilson mentioned that they do encourage mental health checks from AIAs for their athletes. So that was very good to hear from their end too. So this holiday season, traditions may look different, but you can still stay connected. So being connected, whether it's through FaceTime meetup with a few people who support your well-being, inviting someone you know is alone to a virtual or physically safe gathering, or calling, texting a friend, find ways to connect to somebody. Connecting to somebody is valuable. So there's no right or wrong way to spend the holidays. And these are just tips again. And one way I thought was to connect to somebody, connect through virtual, text message, any way you can, and stay creative and don't be afraid of forming new connections. While being with others may look different this holiday season, we still have many ways to stay connected. Reach out if you need support, and that connection will go a long way. So again, there's no right or wrong way to spend the holiday, and have a self-care plan for the holidays that prioritizes your mental health. Your mental health matters, your emotional health matters. And even working here at Winslow Indian Healthcare Center, it's day by day, and things change a whimp of an hour, sometimes minutes, and we have to adjust abruptly, and it gets tiring, I get tired, mentally exhausted, emotionally drained on my drive home. It's really draining. And some of my coworkers and I were talking just a couple of days before this town hall, and I've now learned that I'm not in this by myself. I don't feel this way all by myself. I'm learning about their mental drainage, their emotional drainage as well, and that exertion, that exhaustion of working day in, day out. It does get tiring. So in a way, venting and connecting to somebody here that I work with day in and day out, it helped me to feel normal, I guess, to not feel so odd and think I'm the only one. And it finally helped me realize that I'm not in this by myself. There's others that feel this way as well. So that connection helped me understand myself even more, too, that I do need to talk to coworkers. I do need to talk to loved ones and friends and so forth. So that's what I encourage you to do, is have a self-care plan and making that connection in that plan and prioritizing your mental health. Your mental health matters, and your overall wellness, including in that is get enough rest, drink more water, take a daily walk, a stretch, even if it's a mile, half a mile. You don't have to exert yourself and whatnot. Just that 15-minute walk will work. And of course, take your medications as prescribed, and keep health and therapy appointments if you can get those massage appointments in. It's those little treats matter to your mental health. And even just setting small daily goals, reading 5 pages of your book, sending a friend or text to check in on them, and preparing a healthy meal. We've been told to stay home, stay home, stay home. So we should have a little bit of time to prepare that healthy meal. It doesn't have to be extravagant or anything. Preparing a healthy meal will definitely help us feel better. And that will give us a sense of accomplishment without feeling too too much on our plate. Also identify someone you can call when you're feeling down. It's your best friend, your significant other, your spouse, your family member, your sisters, anyone. Find that someone that you can connect with, and at the WIP, you can call them anytime, day or night. They're there. And limit intake of news. Coworker and I were just talking about this, that her and I have limit our intake of news. There's a lot of messages and news about COVID, the vaccine, and it's overwhelming to our mental health and our wellness to try and figure out what's happening to us in there in our brain, and it gets too much, it gets too overwhelming. So limit that news if you can. And social media as well. Social media has a lot of fake news, they say. So do your homework as much as you can, find the facts. If social media is your way, you can start there and then go to a website to see if it's true, that sort of thing. And also limit intake of substances or any other consumption that leaves you feeling more drained than empowered. So for example, substance like soda. We all love soda, but try to limit that, because too much soda causes us to be not feeling so good. It tastes good and whatnot, but too much can leave us to not feeling that great. So limit those things like that. And then tell others about your plan and what you have your plan about yourself and your mental health. And if you find yourself having difficulty coping, it's usually an indicator that it's time to reach out to a professional or someone other than who you have in your go-to person. So it's okay to reach out to other people, to professionals, and it's okay. Like I said, there's no right or wrong way. And also, caring for your mental health may look different this holiday season. Maybe part of caring for your mental health is about what you don't do this holiday. One aspect of taking care of your mental health involves proactively reducing stressors when you're able to both present both those in present and those you may see coming. So we've all surrendered to the pressure of buying gifts sometimes, and buying gifts we can't afford, only facing bills forthcoming in January. That's some stressors that come along later. So just realizing that caring for your mental health may look different this holiday season, and different meaning FaceTime calls, text messages, Zoom meetings with your family, and so on and so forth. That's going to look different this year. We're not going to be hugging our neighbors, our family, and so forth. So it's definitely going to be a different holiday season. But again, through all of this, your mental health does matter. And again, there's no right or wrong way. Also, setting healthy boundaries protect your mental health. Working here at Winslow Indian Healthcare Center, there are days that we end up staying late, and setting that boundaries of time to, yes, I'm gonna leave at 6, I'm gonna leave at 6:30, but majority of the time we end up leaving till 7, 7:15, something like that. So making sure that you set that boundary to leave at 6 o'clock from work, if that's what you're telling yourself and that's what your schedule says. Set that boundary, and even letting your family members know that boundary. Hey guys, I'm only going to have visitors on Zoom on Christmas Day, or if you want to visit, we can visit outside only, for 5 minutes, to set that boundary, just to make sure that they understand that you're protecting yourself and your mental well-being of protecting yourself, your kids, and your family, and so on. So setting those boundaries, protect yourself, is definitely a good way to start and stick with that boundary. And perhaps you feel obligated to spend time with certain individuals, knowing that you leave those interactions feeling worse. The only true obligation you have is to take care of yourself this holiday season. So while we can't control those actions of others, we can limit our exposure to interactions, people, places that leave us feeling worse about days ahead. Setting healthy boundaries is an act of self-love, and you deserve that this holiday season is that self-love. Love yourself. Stay connected to your family of choice instead. Those who support you and allow you to express yourself authentically. Be yourself. That's another way of saying that. Be yourself. And 5, it's okay to feel both love and loss over the holidays. A gift you can give yourself this year is allowing emotional space for your feelings, whatever they may be. You can appreciate what you have this holiday while also feeling deeply saddened by what has been lost. You can experience love towards those not present while missing their presence terribly. You can feel both fearful and hopeful. There's room for all of your feelings, and they don't cancel each other out when you allow yourself to experience all of them. Keeping a diary or journaling, talking with a trusted friend, and engaging support groups or therapy, or all things you can do to help you express those feelings. And expressing those feelings will help us connect with somebody that we trust. Having that trust in someone is, I know it's hard to come by from time to time, and expressing your feelings for you and your mental health is definitely a way to love yourself as well. And last one, it's okay to not be okay this holiday season. All of your feelings this holiday seasons are valid, including those that are difficult or unexpected. Allow yourself to feel whatever comes your way. Allow yourself to feel. A good goal this season is to try not to feel happy throughout. Holiday seasons, we're always expecting to be happy and jolly, but it's okay to not feel happy this holiday season. But try to allow your authentic feelings to surface and get support when needed to cope with them. Understanding and coping with your own feelings is also very important for yourself, for that self-love to happen. Also remember that feelings can change over time, especially in their intensity. We talk about roller coaster feelings, and it goes up and down. It changes by the hour, by the day, by the week. It happens. Intensity levels change every day. You will find that in sharing your feelings, you're not alone. And that's what I experienced this week with a couple of coworkers. I finally shared and connected with a couple of coworkers this week, and that's when I realized I wasn't alone. And I really felt better after that. So the holiday season is an excellent time to explore joining a support group, whether it's virtual, online, or start your own therapy session group with your trusted friends, your trusted family, and just start talking about your feelings and processing those feelings with yourself or with them. And again, it's a way to connect and cope through this holiday season. So resources to call and connect, there's a few that I listed here. One here from Winslow Indian Healthcare Center Behavioral Health Program, I listed a phone number. And Navajo Nation Department of Behavioral Health Services, they also have a Delcon. I listed the local Delcon facility. And the after hours number, the after 5, there's a cell number that you could call there. And also statewide resource, the Resilient Arizona Crisis Counseling Program. There's also a website that I listed here. You can also dial 211 within Arizona, and an 877 number where you can call from anywhere to connect with the provider. There's also the Substance Abuse and Mental Health Services Administration Disaster Distress Helpline. It's an 800 number you can call anytime, anywhere again. There's also a National Suicide Prevention Lifeline. It's an 800 again, or you can text that 741741, either hello or something, to text that number, and you'll be connected to a crisis text line counselor, and they'll respond to you. So there's a few resources that I've put out for your reference. And again, please, I encourage you to talk and connect about your feelings. Your mental health matters, your emotional health matters, and it's just learning about yourself day by day. I learned quite a few things about myself this week, about being exhausted from work, working hours on end, and being away from family and so forth. So I'm not in it by myself. I learned that definitely this week. So it helped me a lot to feel better and to talk to my coworkers more. Thank you.
Yeah, thank you for that valuable information. And that was a lot of information. I know a lot of people out there are dealing with this. A lot of them out there are looking for answers in various ways of getting help. And there's no shame in getting help and asking for help. Well, sometimes we feel ashamed and embarrassed to ask for help, but don't be ashamed. Don't be embarrassed. So thank you very much, Lisa, for all that valuable work that you're doing and also the information you shared. Those of you that didn't get a chance to watch this, it will be recorded. It will be uploaded on our website. It will also be uploaded on our Facebook. And also we have an email, which is schoolhealth@winslowindianhealthcarecenter.org. So schoolhealth@wic.org. You can go there, ask questions, and someone will get back to you. I'm going to turn the time over now here to wrap this up this evening. And after he's done, we'll take a couple of questions after he's done. But I want to give him some time before we conclude. And this young man, when I got to meet him, he was working with WIC as an employee. And then now he pretty much advanced himself into a leadership role. He also represents the OPVP office of the Navajo Nation, the President and Vice President's office. He's the executive assistant there. He's also serves on the Winslow Indian Healthcare Center board. And he also just recently was elected at the Navajo County supervisor for District 2. So he's our leader in our Winslow Service Unit area. And so we wanted to give him some time to address us and talk to us this evening. And I'm so glad that he was able to make it. So my little brother, Cecilia Alberto Petrobe. Go ahead.
Good evening, everyone. Thank you, PAX, and our participants for the opportunity and for the presentations that have been provided to our community through this virtual town hall. For those of you that do not know me, Adon and Schlinigi a Twitch evening, Schlinkinya on a Bashichin, Nash Edget Kapma a Dashachiaro Twidik Unje a Dashanaledo Tuhak, Ledo Shada a Twidik Unj, what the A Ada and Yasin Shadow Ashiaho a Akut Alno Hokati, the Nebelashka in Schle. And again, thank you very much to each and every one of our presenters for taking the time to assist our Winslow Indian Healthcare Center in this virtual town hall for the Winslow service area for the schools that are located within this area. In addition to that, I just like to share the content. One moment, as it is right here. Can you guys see that? Okay. Well, in my closing remarks, I'd just like to share this information on behalf of the Winslow Inland Healthcare Center that the community drive-through flu shots and COVID-19 testing, the next one that will be taking place is on Tuesday, December 22nd from 10 a.m. to 12 p.m. Mountain Standard Time at the Winslow Inland Healthcare Center Loop Field Clinic. And then the next one will be there on Tuesday, the next one will follow on December 29th. So I'll just go ahead and leave this information here for you to see as I go ahead and in this. So let me start. Let me sort of draw this Winslow Service Area School Virtual Town Hall meeting to a close by first saying that I hope this information was helpful. I hope that it would help answer some of your questions and concerns. And we do want to hear from you, as PAX and everyone has said, so keep the questions coming. And this will not be the last of these virtual town halls. And let me return to some of the things that that we started with. First, just say once again how difficult it is for all of us in this situation, the COVID-19 pandemic, and how important it is that we look after the most vulnerable within our community, especially adhering to the COVID-19 school mitigations information that was provided this evening. And then we all are indeed in uncharted waters, but we are in these waters together. And I'm extremely proud of the way that our communities have already come together to try to chart a way forward. And I know that we will continue to do so, and we'll do the best we possibly can as a Winslow Inland Healthcare family with our partners under these uncertain circumstances. So thank you all. Thanks for joining us this evening. Stay safe, mask up, wash your hands with soap for 20 seconds, use hand sanitizer, and also to social distance. Merry Christmas and Happy New Year from the Winslow Inland Healthcare Center and the Board of Directors. And then thank you, PAX, for moderating this evening's presentation. Thank you.
Thank you very much. And we'll go ahead and do a couple of questions. I know Sasha had one. Sasha, can you come back up here and someone to ask about the numbers after Thanksgiving. So, Sasha, go ahead.
Hi, so we did have a question, I believe, on the Facebook page asking when the current numbers for immediately after Thanksgiving would be shown. That is being prepared at this time, and that is directly prepared from our public health nursing staff and contact tracers. And they've just been very, very busy the past couple of weeks due to the drastic increase in cases. And so the slides that I did show reflected that there were maybe about 40 or so new cases in one day. I know those numbers now with the Thanksgiving holiday past, the numbers are way more than that per day, per case. And I can say that this week we have seen the highest number of tests being given in one day, up to even 300, almost close to 340 people coming to get tested here at Winslow Indian Healthcare Center in one day. And in thinking of that, our positivity rate is still up there in like 16%. So with all those number increase in testing, we're seeing a high percentage of those tests coming back positive.
Thank you, Sasha. And we all know that the number one cause of why the COVID is spreading is because of family gatherings, and people traveling. Most importantly, the gathering. And I know it's that time of year, so let's encourage one another to not gather this year and wait until next year. So let's make that sacrifice this holiday season and just get together with your immediate families only. So that's that. Does anybody have any question at this point? We'll do one question and then we'll go ahead and wrap this up. Anybody want to ask a question that's on the panel this evening? Is it past your bedtime? Anybody go to sleep? If nobody asks a question, I can go. Let me go over here to Facebook Live, and let's see here. I have some. I'm here at the chat box. It says, as a parent, you always hope that the coaches will adhere to the precautions. It's frustrating when only some people are following the guidelines and putting their freedom over safety. My concerns about precautions not being enforced. So, Dr. Wilson, are the precautions being enforced?
Thank you. I think that's a great question. So yes, we are really trying to do the best and do our due diligence to enforce what we have recommended and the things that we have mandated. So I can just give you kind of some examples. And we always encourage, so our executive director is David Hines. He encourages, if you guys have a coach who's not doing something as a parent and you're worried about your kids being at risk or your family being at risk, we don't want that to happen. We want this to be as safe as possible for them. And so if there's something you're concerned about, please reach out to us and let us know. We can't be everywhere. And so we're actually asking the parents and even some of the coaches and athletes to be our eyes everywhere for us. I can just give you some examples of some things that happened during football and volleyball season this fall. We did have a coach who was refusing to wear a mask. We actually ended up suspending that team, and they could not play a game. They either had to suspend the coach or suspend their game. They chose to suspend the coach, and then he did apologize and has now worn his mask for the second half of the season very vigilantly. We also had a volleyball. We had a picture taken of a volleyball team that was playing, and the referees, it was like right after we made our recommendations and published the fall guidelines, the referees were not wearing masks. And very quickly that got back to the IA and the SMAC. And, that was rectified where all the referees for all sports and umpires and everybody were wearing masks all the time. So we are really trying hard to do everything that we can to make this as safe as possible. I can also just pass on just some good knowledge in discussing with the state health director, Dr. Kara Christ, and then the state superintendent, Kathy Hoffman. They have not been concerned about what we did with fall sports and those being like kind of what people have referred to as super spreader events. They have found that what we did with high school sports did not really contribute significantly to increased cases of COVID-19. And so I think everyone really did a good job of trying to band together. We're just very concerned, even contributing a small amount to what's going on right now with how, the spike is actually, as many people on this call tonight said, is higher than it was over the May and June and July spikes that we saw. And so we definitely don't want to even contribute even a little bit at this point. But at the same time, we're trying to balance, the needs and the well-being of our kids with mental health issues, which was also addressed this evening. So we are trying. So definitely let us know if there are people who aren't following those measures, which is why I think it's important for you guys to have access to what we're asking the coaches and the teams to be doing, which is why I provided that link to the website.
Thank you so much. You talk really fast.
I'm sorry.
That was perfect. I'm sure they can watch this back and slow it down a little bit. But no, that was great. Thank you for all that you're doing. And I don't think we can take any more questions now, right, Sasha? We can go ahead and start wrapping this up. Do you want to give us a closing remark, Sasha?
I just want to thank everybody for joining, parents, and if you have your little ones or your teenagers watching with you, thank you. School staff, I want to thank you very much for all that you're doing, and we're just coming alongside teachers, principals, district superintendents to help you in this time, to keep you encouraged, and just to say that we're going to get through this. Let's just be patient together. Let's work together. Let's think about our neighbor as we think of ourselves, and just look out for one another's safety. And we can never be too safe. And so just want to encourage all of you that, and parents, please, reach out and let us know. I know that you're doing your very best you can. And one of the things that, and we know is important, is for those who are in person, you want them to remain in person. A lot of our athletes want to play sports. And as parents, we know what matters to our kids matters, to us too. But we got to do our part when we go to work, when we go out and make choices to go gather, or we go to the stores and, we decide to do all these outside activities, and we come home and then our children go to school, or we have people that go to work. It just impacts one another. So we just got to keep hanging on and take care of one another. And we can do this. We can do this. And so I just appreciate all of you. Well, if you have recommendations on other topics that we can cover for our town hall meetings, email us schoolhealth@wihcc.org. And we want to hear from you. Give us some feedback. Appreciate it.
Thank you. Yeah, it's a beautiful, wonderful evening of learning and encouragement. And thank you, all you professionals, everyone that tuned in, live, Facebook Live, everybody out there, runs the service unit. And what we're going to do is record this, upload it for those of you that missed it, and we'll share this later again on our website and Facebook page. And this is the two of many more to come. So we'll have many more town hall meetings down the road. And again, your suggestions are welcome. Yeah. Thank you. Happy holidays and be safe. Good night.